If someone were to ask me, what's this plan about? So you could say it's about two things. It's very patient-centric, so we spend an awful lot of time talking about our patients and our priorities for patients. And it's also about issues around the patients, their needs, have gone up, their expectations at the same time have gone up, their complexity's gone up, they're getting older, but at the same time, money's not going up. There is no new money. We haven't had a base budget increase in years, and we're not going to have one. We didn't have one this year, we're not going to have one next year, and I would bet we're not going to have one the year after. So sustainability in the context of this is an issue. So this plan, I believe, deals with these two things, which I think are the important challenges going forward in the future. We have a new vision, and the vision statement is world leadership in urban health.
So an area that'll be an early focus, and in fact an area we're already working on comprehensively, is looking at transitions of care. This is how patients move from providers of healthcare or move from organizations as they go through their healthcare journey. And as an initial strategy, we're going to focus on the integration of specialty care services at the hospital with our family health team. We need to keep the patient and family experience at the center of what we do. We need to include the patient's voice and perspective as we make decisions about how we're going to move forward. Ultimately, we want to be not just a community-based urban health center, but we also want to be a leader in community engagement.
What we can do is we can leverage the expertise we've developed and the knowledge that we have to design new systems of care for people that experience severe and multiple disadvantage, people with mental illness or addictions, vulnerable seniors, people that face other challenges related to the social determinants of health, like poverty, homelessness, or legal issues, social exclusion, for whatever reason. To do that, we need to start working somewhat differently. As was said before, we need to look at integrating not only mental illness with addictions, but mental health with the rest of health and hospital and communities. And not just along the continuum of healthcare, but bringing other sectors and resources that go along with shaping one's experience and life and quality of life.
When most people think about critical illness, they actually think of what goes on in the critical care units. But I can tell you that here at St. Michael's Hospital, it's way beyond that. Critical care and critical illness starts before and on the way to the hospital and throughout the entire hospital stay. So it consists of multi-system trauma, cardiac arrest, complex heart disease, shock, neurological emergencies. All of these are part of managing patients who have critical illness. We accept patients from across the province, from outside of the province, who are actually the sickest in the province, and we care for them here. By working internally with our community partners to provide seamless transition from the community through our emergency department into our hospitals and out of the hospitals to rehabilitation. A key to this includes the integration of translational research and advanced state education to keep the focus on patient care, improving patient outcome. So obviously, the new patient tower is going to be critical in this. And with the juxtaposition with the research center across the road, we'll not only be able to care well, but bring new care to our patients. And I believe that all of this sets us up to be the premier critical care hospital in the country.
I think this is exciting because I think it really does, in fact, build on what we already are, and it is something that we can absolutely own. If you argue that Toronto is the largest urban center in Canada, and we are the urban hospital in Toronto, no question.